Day, paying percentage, paying minimum daily, what's going on, and I went out there and found a job in Upper East Side in a really nice posh office. And I also, most of you, as you know, you're looking for jobs right now. You can't really land that full-time job in a urban place. I'm from San Francisco, so whether it be San Francisco or New York City for that matter. So you got to kind of like moonlight or work at a few different offices. So I also had a job deep in Queens, and we worked out a deal with the senior guy and the practice owner, and I went to work. I was kind of nervous. I wasn't sure, how I'm going to deal with all the patients and everything. And I started working. And all of a sudden I realized that, wow, there are patients different than the patients we treat as residents that have no cavities, that don't need any treatment. They're just pretending to be treated. It's like it's just weird, And then there are these patients that are not living close to where we're working as residents, and are going to God knows where, which is one of the places I was working at, down in some basement with almost no instruments. I was scared to go to work at that office, but that's what I thought when I had to pay for my loans, And I was within the same week, I was I was living a nightmare of having to go to that, Medicaid middle practice, dealing with these kids that have been in war zones almost, being papoosed from dentist to dentist, and just not being really treated like a 3-year-old. To go into the Upper East Side, where the nannies are bringing the kids, and their insurance starts Gold American Express, and they don't even need any kind of treatment. And I was just like, this just isn't right. So I got together with a mentor of mine in residency, who was actually operating a dental office in Brooklyn, where he saw overwhelmingly Medicaid children. And I asked him for mentorship, and he advised me that it's possible, it's doable, you can do what I'm doing. And so I took a leap of faith, and everyone that I talked to said, no way, it's not going to work, besides this one mentor that I have. And that's a really key thing I want you guys to remember. You've got to find that mentor out there. Find that person you really look at and say, you know what, I want to be like this guy or this gal. I really feel like I connect. Because it's really, really important to find that person. Had it not been for this individual, Dr. Lara Madrono, which many of the people know, I would clearly not be here. And he really helped me set up this practice, and we started a practice in Queens, and I was lucky enough to partner up with a pediatric ophthalmologist who set up an initial part of the practice, and we had this big 5,000 square foot office, and we really set up a nice office. And I was like, you know what, if I'm going to set up an office, I want my sister to be able to bring my niece and nephew, or Miss Lopez to bring all her 6 other children, and see me. It should not really make a difference. A 3-year-old is a 3-year-old is a 3-year-old. It doesn't really matter who their parents are. As a community, it's our responsibility to help safeguard that 3-year-old smile, the most precious gift they've been given. And so, it can be tough. Find a mentor, like I did, and get organized. And, it's not easy, but when you think about what you're doing, and when you look at that mentor, and see the possibility, then there's no turning back. It doesn't even make sense. That was a great example. The kids are dying of whatever disease. Professor Attaie puts it best. Had we found out all of a sudden yesterday that cavities is a new disease, we would not be treating it in this way. We would have a totally different way of thinking about it. But somehow we just accepted the fact that, this is how it is. That 75% of decay is going to be in 7% of 3-year-olds and under, and that's just the way the dice fell for those poor kids. So just think about that, and think about the possibility.